You had Ted Cruz, as a speechwriter, say, we should declare victory on the one-year Obamacare delay. This, of course, is what they were asking for. That's about how long it takes to log into Healthcare.gov.
Ba-dum-dum.
Yes, and that's actually what she tweeted on her, that exact thing. But how long now, are we going to have to wait to see if this thing works? I mean, does it feel like they have enough time to fix it? What's your sense?
Depends how bad the problems are.
Yeah.
Look, things like changing the way that application is hosted, that can be done relatively quickly.
Yeah.
If the code's really bad, then you have a bigger problem. What's the tolerance for taking it offline? How quickly can you rewrite it? How quickly can you diagnose and fix the problems? Are you letting the same people who let it go live and who supervised it and who signed off on it, right? Because remember, there are people at CMS, the Centers for Medicaid and Medicare, who are unknown, right? They're the people who are working underneath it, or who worked with the contractors in question, and who said, let's go live anyway, even though they might have been saying, watch out.
Which is what we found in
and
that story today.
And if they're the same ones that are in charge of fixing it, you have to kind of ask the question, well, if you supervise this and you work with contractors who muck this up, what are you doing to make sure that the product is getting fixed or not? A lot of people want to see accountability, heads roll. The question is really, can you do that when the people who know the most about the code are the ones who built it? And we'll see. Look, they have time to fix it. One thing that's really important to look at here in terms of the deadlines is that there's a huge amount of publicity and obviously resulted in traffic to the site. At launch, it's not the most important time, right? It's a huge PR disaster.
For them,
You're going to lose some people who might have come in and now get frustrated and walk away. But the deadline to get in enrollment is actually back in December 15th. And if Americans are like a lot of people, and remember, they really want the young ones.
To get it by January 1st, but they can still wait until March.
They got to finish it by December 15th. The time when the load is the most important, handling it, and the time where it needs to work the most is probably December 13th. When you have 48 hours left to get it done, and all those people are like, oh, I need to get insurance, or I'm going to get a penalty, are then going to hit the site.